and crime from the victim's hospital bed. Travis County is working on a program that could reduce retaliation as well as re-victimization. Good evening. Thanks for joining us. I'm Daniel Mudding.
And I'm Britt Moreno. Now, this initiative is called Hospital-Based Violence Intervention. And tonight, KXAN's Brianna Hollis shows us how a similar method is proving to be successful out of Houston right now.
It was an act of violence where I had a traumatic brain injury.
Destin Henderson says he had a rough experience at the hospital after his attack.
They called the police to monitor me, and that wasn't needed. I just needed a person that had the expertise, that had the experience, that had the knowledge.
Things changed when he met his specialist with Harris County Public Health.
I felt like she was there to help me.
Sometimes victims need help navigating the criminal justice system or even accessing mental health resources. And oftentimes, unfortunately, victims either end up back in the hospital because of future attacks or even in jail for retaliatory attacks.
Working with residents who are victims of gunshots, stabbings, and aggravated assaults. Once we receive the call, and then we go and meet these victims and their families at bedside.
The program is currently in one hospital in Harris County. Hospital staff lets victims know about the program. If that victim wants the service, staff will call Harris County Public Health, who sends a specialist to the hospital to meet with the patient as soon as possible. According to other cities that have implemented this program, the most common needs for patients are mental health resources, legal assistance, employment, housing, and education.
Ultimately, they could also then refer those victims to the Trauma Recovery Center.
Here in Travis County, commissioners voted to set up the Trauma Recovery Center, which will help provide these resources long term. The hospital-based intervention would act as a bridge to this facility.
Whatever it is that they need to help them heal, so that one-stop shop.
One-stop shops that can have a lifelong impact for people like Henderson.
I'm doing great. I got part-time employment. I'm blessed and I'm thankful.
Brianna Hollis, KXAN News.
The hospital-based intervention program in Travis County is still in its very early planning stages. In Harris County, 44 patients have participated in the program since it launched in November. Several major cities across the country use this program, including Chicago, Philadelphia, and San Francisco. And in Chicago, people who received the services were less likely to get re-victimized. According to a review of that model, 20% of patients who didn't join the program went back to the hospital within 6 months, while only 8% of victims who did join the program went back to the hospital.